Hello, I am Ingemar Turesson. I am Associate Professor at the University of Lund, working at the University Hospital of Skane in the Department of Hematology. I am here at the ASH meeting to discuss the results of a study of monoclonal gammopathy of undetermined significance and risk of lymphoid and myeloid malignancies. 743 cases followed for up to 30 years in Sweden. Now, monoclonal gammopathy of undetermined significance is much more common than multiple myeloma, and it is often detected in routine medical examinations, and it's important to address what to do, because we know that there is a risk of transformation to myeloma and other lymphoproliferative diseases. But the risk is very heterogeneous, and some patients will never develop it, and those should be reassured and do not need regular follow-up. But some patients have a high risk, and it's important to identify them. They could be the target of new trials in order to stop the progression. So we think that it is important to do this. This has been done before, as you know, by the Mayo Clinic, who constructed a risk model, but it has never been validated. So we started testing the same variables as in the Mayo study and found similar results. We had an annual risk of developing myeloma about 0.5%, which is a little lower than in the Mayo study, but we identified the same adverse factors, like this, an abnormal FLC ratio and an M protein concentration of 1.5 gram per deciliter or more. In addition, we found that the depression of uninvolved immunoglobulins, that is an expression of immune suppression, increases the discriminatory power of the model. So the conclusion is that since this model now has been validated, I think that we should use these tools to identify patients who can be reassured and do not need close follow-up, and those who should be monitored more closely so that treatment could be started without delay, and who could be subject to trials aiming to stop the progression.